Hello everyone, I'm Professor Lee of Dr. Oval Medicine TV. Today, a person suffering from Parkinson's disease visits the clinic. He is currently taking prescribed medication, but he wanted to consult about methods he can use at home. Parkinson's disease is caused by the gradual loss of dopamine-producing nerve cells in a specific area of the brain that controls movement, specifically the substantia nigra. Typical symptoms include tremors, slow movement, muscle stiffness, and balance problems which gradually worsen. In a healthy person, there are about 400,000 dopamine neurons in the substantia nigra. In the case of Parkinson's patient, motor symptoms begin to appear when about 50 to 60% of these neurons are lost. And when the amount of dopamine production decreases by more than 80% of normal level, symptoms become evident. For this reason, Parkinson's disease is often diagnosed after significant brain damage has already occurred. Modern medicine cannot completely stop the progression of Parkinson's disease, but there are various treatments that can manage symptoms, slow its progression, and improve quality of life. The two most common methods are medication and electronic pills. The most important treatment is medication. The most commonly prescribed medication is levodopa. Since it's a disease caused by dopamine loss, it naturally improves when dopamine is supplemented. Since the improvement in symptoms is so remarkable, complications such as fall or fractures that often occur in Parkinson's disease almost never occur, so the average life expectancy of a Parkinson's patient receiving medication is almost the same as that of normal people. However, there is one problem. The effect is good for the first few years, but the effect of the medication gradually decreases after about 5 years, although this varies from person to person. This is because Parkinson's disease is a disease that progresses continuously. Therefore, it's good to use various methods to slow the progression in addition to medication. Electronic pill is a method of improving symptoms by stimulating the brain nerve through electrical stimulation. It's a treatment that controls motor symptoms through electrical stimulation by inserting electrodes into specific part of the brain, and it's called deep brain stimulation. There is also a transcranial magnetic stimulator or transcranial direct current stimulator treatment that stimulates brain cells using magnetic field or electricity from the outside without surgery to implant the electrode in the brain. Recently, electronic pills that are gradually becoming smaller and easier to carry are being developed, and electronic prescription technology that combine with AI and allow convenient stimulation intensity prescription from a doctor at home is also being introduced. Next is stem cell treatment, which many people are looking forward to, although good results have been reported in the early stage after transplantation into the brain. It's not yet at the stage of clinical application. There are many issues to be resolved, and steady research is still ongoing. 1. The survival rate of transplanted stem cells is low, and they often do not settle stable. They may be effective at first, but their effectiveness may gradually decrease. 2. There is a possibility that transplanted stem cells may not sufficiently change into dopaminergic neurons or may become abnormal cells. 3. Transplanted stem cells may cause immune rejection. 4. There is a risk of cancer when embryonic stem cell or induced pluripotent stem cell are used. 5. Stem cell treatment does not show the same effect for each patient. 6. It costs too much to commercialize. From now on, I'll tell you some good methods that patients can do at home in the current situation. Let me tell you just 3 things. The first is exercise. Summarizing the research so far, exercise has a positive effect in improving symptoms and slowing the progression of Parkinson's disease. So, what kind of exercise is good? First, it's best to do the following 4 exercises. 1. Aerobic exercise, walking, cycling, swimming, etc. 2. Strength training, lightweight training. 3. Balance training, balancing, yoga, tai chi, etc. 4. Stretching and flexibility exercise. In addition, dancing to music, that is very good. Aquatic exercise also good, and Pilates is also good. Do this exercise according to your physical strength, and it's very good to receive exercise guidance from a specialized center. The second is food. For food to be effective in slowing the progression of Parkinson's, it has to be a food that has been proven to have anti-inflammatory and neuroprotective effect. The one thing I'll recommend you eat at least once a day is a salad mixed with green leafy vegetables, berries, and nuts. Lastly, drink. Do you all drink tea at home? Then, instead of the tea you are currently drinking, I would like you to drink herbal tea that has been proven to improve Parkinson's disease in clinical studies. There are 5 herbs that have been reported to be effective in clinical studies. 1. Velvet bean, scientific name Mucuna pruriens, contains natural levodopa components and helps increase dopamine levels. 2. Coptis kinensis, which has a neuroprotective effect by reducing inflammation and oxidative stress. 3. Ginkgo leaf improves cerebral blood flow and protects nerve cells. 4. Green tea has a dopamine neuroprotective effect. 5. Bakelin has an anti-inflammatory effect. All of these have a clear neuroprotective effect. The one with the most clinical studies is velvet bean. This plant is the fruit of a legume that grows in tropical areas. It's called velvet bean because it has a pod with soft, velvety hairs, and its seeds are rich in L-dopa, a dopamine precursor. This is the shape of the leaf and flowers. It looks like East Asian arrowroot, right? East Asian arrowroot is also a legume family. According to a controlled clinical study reported in 2017, patients taking velvet bean had a similar symptom improvement as patients taking levodopa medication, but the effect was more sustained and had fewer side effects. However, I would not recommend it. The L-dopa content of velvet bean products can vary from product to product, making it difficult to precisely control the dosage. Most patients are also taking dopamine medications, so if they take velvet bean together, it becomes difficult to control the dosage of important medication. In addition, sometimes side effects occur due to excessive dopamine. However, it can be helpful in the following cases. Some patients experience side effects such as dyskinesia or nausea when taking levodopa. In such cases, velvet bean can be used together without increasing the drug dose. It can be considered when the effect of long-term levodopa medication decreases or the drug effect quickly disappears. Velvet bean has a fasting-acting characteristic, so it can be used as a supplement during the time when the drug effect disappears. The tea I'd like to recommend as a drink is a ginkgo leaf tea. Based on the results of controlled clinical studies, it has been proven to improve diabetes, vision, arteriosclerosis, hyperlipidemia, obesity, and cognitive function. In particular, there are many effects that have been revealed in the nervous system. 1. Improvement of motor function by protecting dopamine neurons in Parkinson's disease. 2. Improvement of cognitive function and tinnitus symptoms by improving blood flow and suppressing neuroinflammation in Alzheimer's disease and dementia and tinnitus. It can be taken in various forms such as dried leaves, powder, and tablets, but it's better to drink it as a tea rather than a pill. You should use dried green leaves that have not turned yellow in late August to early September, and boil 3 to 10 grams in 1 liter of water for about 15 minutes and drink it as tea. Parkinson's disease is a challenging disease, but you have the power and means to fight it. Medications, electronic drugs, and lifestyle changes are powerful tools that can improve quality of life and slow the progression of the disease. For those of you struggling with Parkinson's disease, there are many scientists working hard and making progress. Until better treatment are available, please do what you can do for now and do not lose hope.